These are the faces of lung cancer. They're just like you and me. Anyone can get lung cancer.
I thought that you had to, have smoked or be around people who smoke or, have a more risky lifestyle or have, family members who've had, cancer, so it has to be genetic. But in my case, I didn't have any of those risk factors.
When I was diagnosed, it was just such a shock. I do have a family history, but of course you don't think 21 years old, really great straight, not college athlete and non-smoker.
We don't have cancer in our family at all. We are relatively healthy. No one in my family smokes. So it was just shock. Our son was 2 months old when we found this out, so it was just horrible to hear.
If this could happen to me, it can happen to anybody. I mean, it doesn't discriminate against anyone. And it doesn't matter if the best athlete in the world or, it doesn't matter.
I was a college athlete, football scholarship, and ran track at Winston-Salem State in North Carolina. And, pretty much kept myself up after college, played a lot of intramural sports, softball, weightlifting, track.
It tells you the insidiousness of this disease, that I could have ended up feeling as wonderful as I felt and end up with stage 4 lung cancer.
We've assembled the brightest thought leaders in lung cancer in the world to be on our ALCMI Scientific Leadership Board. ALCMI is a contractual consortium and collaboration of 7 major institutions across the United States and in Europe, along with several major community hospitals as well.
So a community hospital that may do several hundred lung cancer surgeries today and discard those tissues, now we will have access to those tissues. And conversely, we're bringing the awareness and the technology of the academic centers into the community.
We've assembled a board with people from various disciplines in the business world to help guide us to running ALCMI as a business and making sure that every dollar we spend on research is accounted for and spent wisely, to the end result of lung cancer becoming a chronically managed disease with a survival rate in the 90th percentile.
The first project for ALCMI is a protocol named CASTLE. This protocol brings together scientists, clinical oncologists from around the world in order to really determine the molecular fingerprints of lung cancer.
We're really getting away from a sort of blanket therapy to a more ability to pinpoint a unique molecular signature, fingerprint, if you will, or the biology of what's driving someone's tumor.
The goal is to find out what is the fingerprint of that cancer in that patient, and then to be able to apply that together with other patients to develop new treatments or better treatments.
And as we speak, tissue, blood, and plasma are shipping.
The results of that testing will be sent back to the treating physician within 1 week. So an incredible turnaround. We can make sure that it's the right treatment for the right patient at the right time.
We will immediately start working on putting in place a standard of care for lung cancer treatment for every patient in the United States.
We believe we're doing something, at least in the lung cancer world, that no one else has done at this point.
What an epidemic this is, not only in the United States, but worldwide. This year, about 2 million people worldwide will die of lung cancer. In the United States, it will be over 150,000. In the United States alone, 20 people die each hour from lung cancer.
We have clearly seen a dramatic increase in lung cancer in typically young, never smoking patients, and mostly women, although not all.
The molecular fingerprint of these cancers we're finding is totally different from that of the older male smoker or even female smoker. it is a different disease.
Even the NIH is coming around to it and realizing there is a major problem here that has been under-addressed for a long period of time.
The one thing that we can do that can make the most major impact on this disease is find an early detection method.
We're looking at the breath of patients to see whether the breath that is exhaled by a lung cancer patient is different than that from a patient who doesn't have lung cancer. So there are many places that you can look for these biomarkers. The more you look, the better it is.
Hope is the one thing you can hang your hat on. And Bonnie's foundation does offer a lot of hope.
She has been like such a godsend. Anything I need, any question I have, any support that I need, any materials that I need, I mean, they have been more than willing to help me in any way possible. And I think that they're like that with every survivor that comes through them.
Every single person is important to them. It's not just the idea or the ideal someday we'll cure this. It's like you are important.
Somehow she knows exactly what to say and set my mind back at ease. And I think maybe it's because she's been through it and she has such a compassion.
I'm just very inspired by her story and her organization and everything she's accomplished in what seems to be a very short period of time. It's godsend for a lot of people.
We are the people that have to make it happen. You know, we, the patients, the advocates for the patients, the family of the patients, we're the ones who are going to make this move the fastest because we have the biggest investment. And as soon as I saw that they were speaking my language, that's how I decided this is where I'm going to go. These are the people I'm going to talk to, and this is who I'm going to get involved with, and this is how I'm going to make the most of this situation.
The age of molecular or targeted therapies is real, showing that a tumor in an individual may actually unlock secrets. It says treat with this drug and your chance of getting a response is going to be higher. There's never been a better time, and there's never been more interest in expanding that.
I'm taking this chemotherapy, actually it's targeted chemotherapy, a pill that I take every day, and it's been shrinking my tumor.
This is the right research team. It's the right time. We're now seeing this epidemic of lung cancer in young women. The time is now, the future is now. There is no better time for you to participate in this fight against lung cancer.
We're committed to make this happen. We want to be measured. We want to be held accountable.
As much as we are more than happy to take large donations and anything anybody can do for us, my dream is $20 from 1 million people. And you know, it's actually beautiful because people send in $20, but then when they go to write the check, they make it 25, or they make it 30, or they make it 10. It really doesn't matter. What people need to know is that every little bit counts. There really is no donation too small.
Those monies can go to directly where it's needed, right here in the basic research laboratories around the country of people doing cutting-edge research.
I really believe we, and when I say we, I mean our ALCMI leadership board, I mean our board of directors, I mean our patients, our survivors, their families, we are turning a corner. Lung cancer is on its way to being significantly impacted in a positive way with research.
We can at first have a registry of tissue like nobody else in the world. We can have that available for investigators, not only in the United States, but all over the world, so that they will be able to use this and discover, but also that tissue is being used and evaluated in real time to help the patient.
I know I told you last year that the cavalry was coming. I'm so pleased, thrilled to be able to tell you today that the cavalry is here.
Sometimes in my tears I drown, but I never let this is one of, if not the biggest lung cancer event that's ever happened. Having 5,000 people out here today is unbelievable, well more than we ever thought that would be here, but next year it needs to be 10,000, and the year after, and the year after.
She believed that this was a way to educate people and to bring about a cure. So to have this type of response, oh my God, it's incredible. It's incredible. It's humbling that this many people would come out for her, and more importantly, for the cause to find a cure, because that's what we have to do. So I'm thrilled. I mean, I wish she was here with us, but I guess she is. And I know that she would just be thrilled with this.